My area of expertise is people who have either lost all of their teeth or are in need of losing teeth. And full arch dental implants is something that really has revolutionized dentistry over the past 10-15 years or so. The approach and protocols of what I did years back compared to what we do today is just leaps and bounds ahead. With some preliminary planning, 3D imaging, 3D scanning and whatnot, patients come in and in a roughly 3 to 4 hour procedure, the remaining teeth are removed, the appropriate dental implants are placed, and a complete set of teeth are placed onto the implants all in one day. My team here at the Geller Dental Group has gotten this down to a science. First appointment when we get started with a full arch or full mouth implant rehabilitation involves a 3D x-ray, a 3D digital impression of their teeth, as well as some routine photography. I then sit down with my patients and have conversations regarding the cosmetics. What are they looking for? Shape, size, anatomy. Oftentimes I'll have patients bring in photographs of what they looked like years back and what we're trying to duplicate. From there, I work closely with my lab technicians to digitally design the smile. This is all done in a digital workflow, sitting down at the laptop and working closely with my support team behind the scenes to design what is going to work best, because ultimately when all is said and done, we're left with our smile. And that's ultimately what we're looking to display, is a gorgeous smile here. So once the smile is designed, we then go to production and fabricate the bridge work in advance prior to the day of surgery. Surgery day is visit number 2, and that's the big day for many patients. They walk in with teeth that are in poor shape very often, cosmetically, health-wise, infection-wise, and day of surgery, the affected teeth are removed, any infection is addressed, and our dental implants are placed. Patients go home that very same day with a brand new beautiful smile. We have all the safety stops and measures in place and pre-planning, and most importantly, many, many years of experience and countless number of cases that to this point in time, I have never sent a patient home without a set of teeth affixed to their implants. Patients often ask me, well, hey, I've been told I have bone loss. Can I still have dental implants? Absolutely. People who have been historically very prone to dental decay, phenomenal candidates for dental implants. It is very rare that I find someone that is not a candidate to rebuild their mouth with dental implants. The best moments in life start with a smile. Are you happy with yours? If that answer is no, please feel free to reach out to us at the Geller Dental Group or find us online at gellerdental.com. We'd be happy to sit down and chat with you and educate you on what's available and ultimately give you the smile that you deserve.